Nothing on the Bonnell Foundation's Living with Cystic Fibrosis podcast should be considered medical advice. Medical advice can only come from your CF physician. Cystic fibrosis can be a devastating diagnosis, but living with the disease can bring positivity and a new appreciation for each day. From the Bonnell Foundation in Detroit, Michigan, it's the Living with Cystic Fibrosis podcast, sponsored by Vertex Pharmaceutical. Here's your host, Laura Bonnell.
International Biophysics Corporation creates innovative medical devices. Their devices improve treatment therapies and patient outcomes. For cystic fibrosis patient, it is the afflovest. Prior to the pandemic, I got to try out a vest at the North American Cystic Fibrosis Conference in Nashville, and I met President and CEO David Shockley, a wonderful, down-to-earth person who is made a commitment to making life better for people with a disease or a condition. And they also do some really cool things like provide ozone generators for the space shuttle. They make heart pumps, surgical tubing, and much more. Well, in this podcast, I am delighted to tell you that we are talking with Neal Smith, who is the Director of Marketing and Education for International Biophysics. So welcome, so glad to talk to you. International Biophysics Corporation is doing so many wonderful things. So please start by telling us a little bit about yourself, why you got involved with the corporation in the first place, and kind of a little bit of history about, where you've been in your career.
Well, sure. Thank you, Laura. I greatly appreciate being part of your podcast today. My name is Neal Smith. I'm the Director of Marketing and Education for International Biophysics Corporation. We are the manufacturers of the afflovest. My background, I've been in medical device marketing for 20 years. When I got into it, it was because I really want to do marketing for the betterment of society from that standpoint. I didn't want to do something to get into TV ads and market toys and those things. But, healthcare has always been an interesting arena for me from, my background and my family's background and all the things that are out there that are involved in healthcare. And when your day is done from work, you just want to feel that you've done something that's helped somebody else. And that's what's really attracted to me to it. And that's why I've been in it for so long.
And I love that you get patient feedback. I love that you get feedback from doctors. I mean, the company is fantastic from the top to all of the employees. Very intuitive and listening. I want to talk about the pilot program, the Airway Clearance Educational Program. But I also wanted to say, when I saw the afflovest pre the pandemic, so impressive. And we've come such a long way since my daughters were diagnosed with cystic fibrosis. You had to plug them in. You had this, I don't even know how heavy that the power pack thing, it wasn't even a power pack. It was this massive, it felt like 50 pounds. And you have two kids with CF, so they're both doing the vests. And now they're batteries they can go anywhere in them. They can go for a walk outside. Just incredible how it's grown and changed since these started.
It really has. And you bring up a great point, Laura. And as a company that's pioneered mobile during use vest therapy, afflovest was the first mobile device on the marketplace where you didn't have to be connected to the wall and connected to hoses. You can actually do your therapy when you're doing other things. And sometimes that doesn't sound like it's a big deal, but with all the other aspects of therapy that people with cystic fibrosis are dealing with and just the day-to-day lives is being able to provide, an opportunity to do other things while you're getting your treatments, twice a day, typically for 30 minutes time a day. Obviously, it can be more, but being able to do that and trying to fit the therapy into the patient's lifestyle versus fitting it into the disease from that standpoint and putting the onus back onto the patient that they can do it whenever they need to do it. And so once we got into this business with afflovest about 8 years ago now, it was 2013 when we first brought it to market. As you said, the first version was a larger version, a little bit heavier from that standpoint. But with that patient feedback and talking to clinicians and physicians and the patients that were using this product, we are able to make it more custom fit, more tailored therapy from that standpoint to, right now we have 7 different sizes. The smallest size is about 5 pounds and the largest is about 8.5 pounds. And so it's not a lot of weight. It's very lightweight and easy to use, especially for something that you're going to be using on a daily basis multiple times a day.
And having girls there were just obviously areas that they had to have the new vest adjusted to, and it's just made a huge difference. It was so uncomfortable in the early stages for them.
Sure. And that's why we have those different options and sizes. And, like I said, it's kind of that custom fit aspect because obviously, our patients grow. The children, they're growing up and we need to have those opportunities for them to grow with their therapy. Just as we do in the adult population, adults grow a little bit differently than kids. Sometimes it's up and out versus, tall and the heights and stuff. But you have to be able to provide something that's going to fit for everybody. And that's what we do.
Well, there's so much that we want to talk about. But first, let's talk about the Airway Clearance Educational Program, that pilot program that you have started.
Yes. So the program you're talking about we call it IMPACT, and that stands for Individual Management of Patient Airway Clearance Therapy. And this is a program that started about 3.5 years ago. We were at a conference and we're talking with some physicians and having these conversations with them just about the markets and the disease state, that there was a gap in structured airway clearance therapy education. And honestly, this started in the adult population for bronchiectasis. This was the conversations that we were having. And so we felt, having some more conversation with them, that this was something that needed to be addressed. And there just wasn't one kind of good area to go find all this information. And so we actually hired a consultancy firm called Spark Healthcare to put together an advisory board and really figure out what this means and how would we address this. And why we put together a consultancy firm is because when it all comes down to it is that we want to provide the education. We're not looking for, any money out of this because this is a free program. And so International Biophysics is sponsoring the program, but Spark Healthcare and this advisory board, and we have 13 different centers across the nation, started in the bronchiectasis world, put this together and develop these educational tools that will help patients and their healthcare providers have good conversations about airway clearance therapy and get the right education out there. And as we started that program and started the pilot for the IMPACT BE aspect of the bronchiectasis aspect, because as you know, a lot of pulmonologists don't just deal in adult bronchiectasis, they're also working in the cystic fibrosis clinics as well. And some of them cover both. And they said, this is something that's also needed in the cystic fibrosis world because there's so many different airway clearance therapy options. It's hard to have the time, to go through them all. It's hard to know all of them that are out there from a clinician standpoint as well as a patient standpoint, for sure. If the clinicians don't know about it, obviously the patients are going to have a harder time to know about them. But just the time in clinic. And as you know, when you go to clinic, you're meeting with pulmonologists, you're meeting with dietitian, you're meeting with this, but you don't have time to go into a whole lot of different things. And so having these options of what are all the options for airway clearance therapy to really get into a patient-tailored therapy and what's going to be best for this patient. And so this is what started it. And just recently, we just finished this pilot program with 13 CF centers around the United States where we tested out these educational materials. And from that, we had 100 patients participate, and we have these assessment forms. And these assessment forms is kind of the first step of it. And it's really getting at, from a patient standpoint, what are they willing to do? What are they doing right now? How often are they doing it right now? And really trying to address the barriers to doing therapy. Because if we can find the barriers out, that helps the clinicians put a tailored program together for that individual patient and say, okay, maybe huff coughing might be the right thing for you. Maybe it's vest therapy. Maybe it's something else. But being able to have those conversations and fill out this assessment form, it gives a lot of information to the clinicians to go back and say, okay, well, we typically would recommend this therapy, but for this patient, maybe we need to go down this one. We start with it. And so that's one piece of it. That's the first piece of it. And so these assessment forms have been very, very well received from patients and clinicians because it starts that conversation. It's not just going in and saying, hey, how's things going? Things are going fine. My numbers are good.
Right. And I would think because, again, my girls, they tried to give the right answer.
Yes.
During doctor visits, when I knew in my head, okay, what was really going on? Yes. Are you doing your treatments? Yes. To everything. Yes, yes, yes. And you knew that They're doing the best they could. They're complying as best they could, but you aren't 100%, So that conversation seems like it would be freeing to patients and doctors. Just figure it out and say what's really happening.
And that brings up a very good point, especially, for sure in the cystic fibrosis patient population, it's not just one assessment form. We have for adult cystic fibrosis, there's a form for that. There's a teenager assessment form. There's the child assessment form. And there's, of course, the parent assessment form. So in your situation, you could fill out the form and then your daughters could fill out the form too. And then the clinician can match them up and, hey, are we getting the same answers? And if not, you're having some conversations and what's going on. And that just brings up good conversations. Say, okay, what's really going on and how can we address that? And what's the best therapy that's going to work for this situation and this patient's individual life? Because everybody's got a different lifestyle. And, kids everywhere do all kinds of things, have all kinds of activities. What's the easiest thing that's going to be able to be done for them that they're actually going to do, or at least have a higher probability of doing? And so it just brings a lot more, I'd say, unique conversations. I'm not saying that they don't happen in the clinic, but everything that we've heard in this pilot program is that time in clinic is essential, and we don't have a whole lot of it. And there's only certain things that it can do. And by utilizing this program, like I said, starting with the assessment, maybe when you're in the waiting room or even before you come in. And, obviously we're going through or just hopefully coming out of this pandemic right now. In the past year, we've seen, and I don't know your case, Laura, but patients are doing a lot of telehealth visits. Mm-hmm. And so what we've seen in the pilot program is that the physician was sending to their patient the assessment form, or, hey, I want you to watch this video on huff coughing, or I want you to watch this video on, mobile vest therapy, because I think that might be best for you. And so they were sending that through like their MyChart. And so you could watch that at home before, or you could go to the website. Here's the link to the website. I want you to go watch this video because I think this is going to be the right therapy for you based off of what you're doing day to day. And so it provides a great opportunity of more conversation between parent, patient, and clinician in those scenarios where it's not just, once every 3 months kind of thing. It could give some more cohesiveness between the teams.
Yeah, I think so. And then you hit them when they can look at it, when they're able to look at it.
Exactly.
It's not like, usually it's like 4 hours in clinic on average, and you're just going through one doctor after then the nutritionist and this and that, and it just becomes this thing. So yeah, I think telehealth and what you're talking about definitely changed the whole focus.
Exactly. And just as you said, it's at 4 hours. And what do you really remember out of that? Everybody's going to remember something a little bit different and be able to go back on that. And so on these forms that you can fill out, there's two pieces to that. If you're in person, a lot of the feedback that we received was having the children write things down made it a little bit more accountable for them. It got them to ask more questions about, how does their mucolytics, how does this work? Because in this assessment form, it says, what are you doing right now? And you list it. And it brought in more of those conversations. But then there's also these QR codes, which kids know how to use. And adults, because of the pandemic, adults are knowing how to use it if they go out to dinners, because that's the dinner menu. So everybody knows how to use a QR code now. They can hit a QR code and it pops up, here's the video on how you do this therapy. And the nice thing about the Impact program is, like I said, it's a non-branded, non-promotional. So these videos come from, like, there's a video from Children's Hospital in Cincinnati. Here's a video on huff coughing. We're pulling videos from other places. It's not something that we're developing from ground up. This is stuff that's already out there from these prominent cystic fibrosis, clinics around the country.
And what are you finding out? My girls, I keep going back to my girls, but it just helps illustrate kind of. So they're very active, they're running and very physical. Explain to everyone what the benefit, in addition to that the afflovest does for patients with cystic fibrosis.
Well, I think, as you said, from active people, your active kids are being able to, if you're going to, let's say, a soccer game, you've got the 7 a.m. soccer game, you don't have to get up an hour early to do your treatment before you go. Maybe you can do it in the car. And because you don't have to be plugged into anything, it's a battery operated, the afflovest, you can wear it in the car and do it on your way to soccer practice or your Saturday morning soccer game. Or, if you're a swim meet or track meets, those things last all day and those kind of things. Or, when they become teenagers and doing, travel teams and those things, you can bring your therapy with you and sit in the dugout between games. And so just having that flexibility, it frees them from that standpoint of, like I was saying, your disease state's not dictating at least in this piece of it. And I know we're only addressing one piece of it with afflovest because it's that airway clearance. It's getting that mucus out because that's the whole purpose of it.
Mm-hmm.
But it's at least giving you a little bit more freedom to be able to do what you want to do when you want to do it, because you can do your therapy wherever, because we call it therapy on the go, because you just have that flexibility of being able to do it because you're not tied down to anything. And the nice thing as well is we see a lot of people doing their nebulizer treatments while they're doing their afflovest. And so you can do multiple therapies at the same time, or you're going to do exercise. You're going to the gym for, some of our older cystic fibrosis patients. They work out a lot of times because they do it first thing in the morning. They put their vest on, they're working out. And so they're getting both of those therapies at that same time. So it's helping them from just a time standpoint.
So in that pilot program, was there anything else on that? Did you find out, were there any aha things that you found out wow, okay, we can get more people to do the vest if we do this? What else did you find out from patients?
Well, from that standpoint, it's up to the clinics. From that standpoint, is really we're just evaluating the educational materials from that standpoint. We weren't dictating, hey, you need to be on vest therapy, you need to be on this therapy. Whatever the clinic felt was the right thing to do based off the assessment form and, of course, their experience, and having those conversations with the patients and their caregivers is, okay, this is going to be the best therapy for you. And that's really what it comes down to. It's not a tangible results that, PFTs were this because of that. It was more, I had good conversations. I felt more in tune with my care team, having these conversations and having the right therapy that's going to be best for me is those are the things that we really want to get to. Because, the goals of this program, this educational program, is to address the need in the CF community around airway clearance therapy education and its role in their overall health.
And how much does it weigh, even with the batteries in? I know it depends.
The smallest size fits a 18-inch chest circumference, and that's our extra, extra small. And that weighs about 5 point something pounds. But then our largest is an extra, extra large, which can fit a chest circumference of about 60 inches, is only 8.5 pounds. So there's not a whole lot of weight difference between going from the extra, extra small to the extra, extra large. So it is very manageable, fitting, nice feeling product that's going to do what it needs to do. And the whole purpose is to loosen that mucus from the walls, break it up, and then help get it out there, get it out of your system.
And what do you see for the future as far as vests? Are you already thinking about what's next, or are you this is working, we're sticking with this for now?
As you said in the beginning, we're always talking with patients, and that's something that you liked about it. And that's something we keep doing. We keep talking with physicians and patients. What do you see? How do you want to be dealing with this in the future? We obviously look at technologies all the time, and is there new things that are coming out that we could incorporate to make a better device in the future that's going to keep helping the patients and the clinicians that we work with? And so we're always looking for those things and always looking to make better, because we don't want to rest on our laurels from that standpoint. We want to keep moving as technology moves along. And then what else can we do? And so we're always looking at that. So the interesting thing about this is that there's so many already airway clearance therapies, and not everybody knows about them all. And this is why this impact program has been put together, is to try to help educate and see all the options and have those discussions. But then what should the next thing be? And, that takes time. It takes technologies, it takes lots of conversations, and keep doing those things to see what we can do better.
And then how does they can't really try it out? Health-wise, you really couldn't do that. You couldn't have people sending it to their homes and trying it for contamination reasons. But I was lucky enough to be at the NACFC and got to try one on and feel it and see it and hold it and see the batteries. And it was wonderful. And there's many different companies that are doing vests. So how do you kind of market the vest and get it to people? Is it them watching the videos or reaching out to the company?
It's all of that. Obviously, the CF Clinic is going to be the best resource from that standpoint, because they have the experience and all the different options that are out there. But yes, you can call the company and we can talk about it. We can send literature. We can have, one of our representatives talk with the individual patient and family and go through that. But it really comes down to that experience with the CF Clinic, and that a lot of them have used the different vest therapies. And so they know the differences in them and can explain it to the patients. But if anybody's interested, we're willing to talk about it because we obviously feel it's a great option to have out there. And like I said, especially in the younger population, because they're active and they have things to do. And the adults, of course, too. I mean, they're working and when are they going to do their treatments? And so it's something that you can easily bring to the office and do what you need to do. And it's quiet and it's not obtrusive.
And I would hope that the insurance companies covered the cost of the vest, but if they don't, do you have programs?
Yeah, and it's a little different out there, and it depends on the insurance company. And for the adult bronchiectasis world, it's Medicare approves it. So if Medicare approves it, a lot of when you're dealing obviously with the cystic fibrosis world, if Medicare approves it, it kind of grandfathers in most everybody else. Every insurance company is a little bit different.
Mm-hmm.
But we can talk with the company and see the best way of going about that. And like I said, every insurance company is a little bit different. Some could be a little bit easier to get approved than others. But there's ways that, we can be able to provide some insights and helping get that through the process. And the clinics are doing this all the time too. So they have good insight into that as well, the best way to go about that.
Are the vests strictly what you do for cystic fibrosis? I mean, you do so much for so many other diseases and conditions, but is this the one specific thing that you do for the CF community?
Yes, it is. And we feel we're helping out and we feel that we're helping. We know we're just a very, very small piece of it because airway clearance is just one small piece of course, cystic fibrosis. But as we were talking, we're always looking for things that, how else can we help the patient populations and what can we do better? We're not a drug company. We're not going down that pathway. But anything that we can do from a mechanical standpoint, from a device type standpoint, we're going to be looking at and we're interested in doing. When we talk about CF modulators, my background, I'm not a clinician, but the things that we hear is some clinicians, they're having to have these conversations with their patients now that, some are, they're sticking with their therapies and doing all their treatments the same way they were doing before they got on a CF modulator. But there's groups that aren't, hey, I'm not coughing anything up. I think I feel fine. And so they might not be doing as much of their airway clearance therapy as they were doing before after taking a CF modulator. And so it's really interesting conversations that the CF clinics are having to have, that clinicians are having to have with their patients, because we're kind of in that interesting time that, these drugs, which are great, helping patients out, but what is it going to look like in the long term? We just don't know yet. And so as we say, and we say it because I've heard it from many clinicians, we still, until we know truly what's going to be impacted long term, we still, even though you might not be coughing up stuff now, but if you keep doing your airway clearance therapy and then like in 2 weeks, you start coughing something up, and I'm just throwing out arbitrary numbers, but you're at least keeping your lung hygiene process going and being able to keep that aspect of clearing out, even though you might not be getting something coming out, but at least clearing that and doing that lung hygiene protocol is still a good way to go about it, because right now we just don't know any different. But it's a very interesting time. It's a very exciting time because it's great to hear that these CF modulators are doing very, very well and helping a lot of patients out there. But I think it's still important to do your airway clearance therapy too.
Right. It is a very interesting time with both CF modulators.
Mm-hmm.
I think you're right. I think it kind of goes back and forth for people. They're still figuring that out.
Mm-hmm.
Or even keeping the routine up is important too, as far as everything that they were doing before and continue to do it as they get through maybe their first year on a new CF modulator.
It's just having another option out there. So keep doing what you're doing, kind of thing, because I think the more you can do, the better overall long term. I mean, that's the hope. I mean, that's the whole purpose of why we do these things, is really kind of a preventative health aspect of it, because later down the line, we don't want things to be worse off. And one example I'll say is that, because it resonated with me talking with a physician, is that someone that has high blood pressure, they take a pill every day, but they might start in their 40s or 50s when they first get diagnosed, but they might not see anything. They might not feel any different, but they know long term that's going to be beneficial when they get into their, later on in life, that they're not going to have as many complications with their high blood pressure. And so that resonated from that standpoint. That was a good example, I thought, is, you still do it every day, because in the long term, It's not going to cause more problems. And that's, I think, what all the therapies and these options that we have out there for people living with cystic fibrosis is going to be better for them.
And I just had a crazy thought. I don't know. As you're doing these, can people say, hey, I want a green one or a pink one? Can they design their own, graphics on their vest? Or is there a pocket for their cell phone these days?
What?
Anything like that?
So those are things that we've, of course, heard feedback on. And we know some people because the controller has a little pocket and some people put their phone in there as well. But right now, they're not customizable. Though we've seen very interesting people have made like shoulder straps, like that Velcro, and put them on their shoulder straps. And I remember a young man developed them. He and his mom developed them, and it's like camo because he loves camo. And so he had camo, Velcroed around his shoulder straps just to give it a little bit something different.
Nice.
Stuff like that. So the creativity is a lot of fun to see, but we haven't gotten to the customizable aspect of it because it gets to be quite a lot just from having a lot of different options out there. But it's something that we're looking at, seeing how we can do that.
Well, I love all the work that the Biophysics Corporation is doing and everything you've got going on with the vests. I just am so impressed with where it was and where it's come today, and I'm sure you'll continue to grow with it. Anything else that you wanted to mention about what your company is doing in regard to cystic fibrosis?
I really just kind of come back to this impact program. This is something that we're not doing because we want any money out of it. Like I said, it is a free program. You can go to the website right now and look at all the materials. You can download the materials. You can talk to your, if your clinics don't know about it yet, because we're just finishing this pilot program up with Impact CF. And so as the year progresses and as we get into NACFC season, there's going to be a lot more information about it. And I think it's going to be more known. But you can go to it right now and just educate yourself on what's out there and see these videos and see how other people are utilizing them. That's really it. Because, when it comes down to it, we want to make patients' lives better. And if they're in a therapy that's doing great for them right now, that's perfect. If they're curious about other therapies or maybe the therapy that it's just a little bit too hard, and I know none of this is easy, but if it can be a little bit simpler and fit into their lifestyle and what they're doing on a daily basis, just know that there's other options out there and, go to this website, look at them, understand them, and then just start having conversations with your care team and see where it can go from that. That's what we want to do when the day's done, is help people out. And that's why we put this program together.
Well, thank you, Neal Smith with the International Biophysics Corporation. Appreciate all your information. And if anybody needs to contact the company, we have the link on our Living with Cystic Fibrosis podcast information. So thank you very much.
Thank you, Laura. Appreciate the time.
The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, check them out online at thebonnellfoundation.org. That's BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, the science of possibility, and produced by Jag and Detroit Podcasts.